The Chief Medical Director of Akabuike University Teaching Hospital, Akabuike, Dr. Akabuike has called on Anambra to maximize the modern equipment available in the hospital to meet their different health needs. Dr. Akabuike stated this under his watch. In the past 1 year, the hospital has been repositioned administratively and infrastructurally to meet international best practices in the healthcare delivery. The Chief Medical Director spoke during a special press briefing in Oka to mark his 1 year in office. Correspondent David Obokwasili reports.
Akabuike, who listed some of the achievements of his administration within 1 year to include the completion and commissioning of Mother and Child Referral Center, re-accreditation of residency training program in pediatrics, and for the 5th MBBS of the Medical and Dental Council of Nigeria, and the accreditation of our internal medicine for residency training. Some other achievements Dr. Akabuike identified include the construction of consultants' lounge as a means of ensuring that consultants are always within the hospital premises, which is the first of its kind in the eastern region, building and equipping of the dialysis unit, and training of renal nurses in the use of equipment and other such equipment like the mammography machines and the CT scan. He promised that these reforms, which include the retraining and reward of staff, will translate into better service delivery for our patients.
This hospital is one of the best hospitals that we have in the whole country now. And as I said before I started, it is you that will be the eyewitness. I'm not going to say it, and that's the way I do. And by way of my person and my profession, I believe that action speaks louder than word. That's why with God we share our ideas, and we know that the essence of media is to have to motivate things. We wouldn't mind if there's any way we are not doing very well in terms. The essence is as the person that led us in prayers. It's for the good of our people and for the good of everybody.
On an alleged claim made on the social media that the hospital is extorting patients by forcing them to patronize a particular restaurant within the hospital, the acting deputy chairman of the hospital's medical advisory committee, Dr. Nemeka Umedum, who was charged with the investigation of the claims, denied such extortions but explained that rather the food sold from the said restaurant was subsidized for patients at 50% discount when compared to what patients pay in other teaching hospitals where there is need for control of food that come into the specialized wards.
In addition to having a dietetics unit here, those that are trained to prepare nutritional plans for patients, we also had to bring in vendors that will equally serve nutritious food to our patients.
On his part, the President, National Association of Resident Doctors, Chukwuemeka University Teaching Hospital, Oka, Dr. Emmanuel Chukwuka, praised the administration of the hospital under the leadership of Dr. Akabuike for addressing the welfare needs of resident doctors and implementing to the letter the demands captured in the Consolidated Medical Salary Structure Commerce for resident doctors. The highlights of the press briefing was the tour of the hospital facility and different equipment in the hospital. From the Chukwuemeka University Teaching Hospital, Akabuike, I am David Okwasi reporting for ABS News.